Good morning, clinical instructors. My name is Jeric Mamada, student nurse from Davao Medical Schools Foundation, and today I'm going to do my return demonstration on how to do the procedure on getting vital signs, neurologic vital signs. So in this procedure, we need to make sure as a student nurse to check the doctor's order to avoid discrepancies and to make sure as well that we have the right patient. And after checking the procedure, is we need to prepare all the equipments. So for this procedure, we are going to use alcohol, the gloves, and evaluation sheet, as well as with the pen light. So I don't have a pen light, assuming I'm just going to use a pen. So after preparing all the equipments, we need to make sure that if the doors are open, curtains are open, we need to make sure that it's closed to provide privacy to the client. Then we also wash our hands to deter the transmission of microorganisms. So assuming I'm done washing my hands with the use of liquid soap, so I'm just gonna use alcohol. So after washing my hands, I'm going to put my gloves on. Working gloves. Okay, so once that's done, the next step that we are going to do is I'm going to explain the procedure to the client. So in this, the scenario of this procedure is the client has a brain injury, a mild brain injury. So I'm going to enter the room of the client. Hello, sir. Sir, can you hear me? Sir, can you hear me? Okay, can you hear me, sir?
Yes.
Okay, so my name is Jeric Mamada. I'm a student nurse from Davao Medical Schools Foundation. May I have your first and last name?
Chase Benton.
Okay, and can I may I also have your date of birth?
November 21st, 2007.
Okay, let me check it. Okay, and do you know the reason why we're here today?
No, sir.
Okay, so the reason why we're here today because there is a doctor order that we are going to check neurologic vital signs. That's because you got into a car accident, so we just need to make sure that you don't have problems with your brain. Okay.
Okay.
Okay, so how are you today?
Good, how are you?
I'm doing good. Thank you for asking. So after explaining the procedure to the client, we are going to move forward with the first first assessment, which is the Glasgow Coma Scale test. So the GCS or Glasgow Coma Scale is a clinical scale that is like usually used by medical health workers to assess or to assess the level of consciousness of patient with past brain injury. So this procedure or the GCS has three subscalar components. The first one is the eye opening, and the second one is the verbal response, and the third one is the motor response. So as we observed earlier, as I opened the door, as I entered the door, the room of the patient was not awake. Okay, so he didn't open his eyes. So the scoring of this scale is 4, 5, and 6. So maximum of total of 15. So the higher the score, the better. So as I opened the door earlier, the patient did not open his eyes. So he only opened his eyes when I used my voice. So he didn't spontaneously open his eyes like he didn't watch TV or he didn't drink coffee. So basically he was sleeping. So the time that he opened his eyes when I used my voice. So I called him sir. So I called him 3 times. So on this case, we are going to score the patient 3 because he opened his eyes using my voice. However, if the patient didn't open his eyes spontaneously and using my voice, the next step that we are going to do is we need to like grab a pen and we need to pinch the nails of the patient. So just can you close your eyes, Mr. Benton? So just imagine that the eyes of the patient is closed. He did not spontaneously open his eyes, and he did not also open his eyes using my voice. So what we're going to do is we're going to put pressure into his nails. So the main goal or the main purpose is not to hurt the patient, but to wake him up or to let his open his eyes. So I'm gonna put pressure into the nails of the patient up until he wakes up. Okay, so the patient wakes up using pain. So that means that we score the patient 2 because he wakes up using pain or pressure into his nails. However, if the patient didn't wake up at all, then we score the patient 1 because that's the lowest score that we can give to the patient, because we cannot give 0, because if 0, that means the patient is dead. So next is the verbal response. So Mr. Benton, can you tell me where are we at right now?
Queens Hospital.
Okay, we're in Queen's Hospital, and do you know what is the date today?
January 28th, 2022.
And can you also tell me the current president of the United States?
Joe Biden.
Okay, thank you very much. So the patient is able to answer the question. So the patient was able to answer all the 3 questions. So that means that the patient is oriented. So after that, if the patient is not able, like for example, just for example, if the patient was not able to answer the question, if if he's confused with his answer, like if hesitant with his answer, so we can score the patient 4 for confused. And if the patient is answering the question like in a gibberish way, like can you like show them how to like gibberish way? Okay, very good. So if the patient is like talking gibberish, like single phrases, that's inappropriate. And if the patient is like moaning or groaning, okay, so that's incomprehensible. Okay, so we score them 2 for that. And then if it's inappropriate, we score them 3. So, and if the patient doesn't talk at all, that means that we score them 1. So after the verbal response, we move forward to the motor response. So Mr. Benton, can you do me a favor? Can you open your mouth and stick your tongue? Okay, can you move it to the left and move it to the right? Okay, so the patient is able to follow command. So we score the patient 6. He was able to obey command. Then we score him 6. So after that, if the next procedure is I'm going to pinch the trapezius of the client for 10 seconds. Okay, so if that is the reaction of the client, if the client reacted to the stimulus, that means that it's a localized pain. And if the client, while I'm like holding the trapezius, while he bent his arms and move away from his body, then that means it's a withdrawal from pain. And if the client bend his elbows and move his arms into the middle of his body, like move his elbows, like fold it like that, while I was holding his trapezius, then that means it's decorticate or abnormal flexion. Then okay, and if the patient extend his elbows, can you extend your elbow? Okay, if the patient extend his elbows while I'm holding his trapezius, then that means it's an abnormal extension or decerebrate. So earlier we scored the patient and the eye opening, we scored the patient 3. And for the verbal response, we scored the patient 5. And for the motor response, we scored the patient 6. So a total of 14. So as I mentioned earlier, the higher the score, the better. So that means that the patient has a severe brain, a mild brain injury, because 9 to 12, it's a moderate brain injury. Then 12 to 15, 13 to 15, that's mild. Then 8 below, that's severe. That means that possibility is the patient has a coma or in coma. Then after the GCS, let's move forward to checking the pupil of the client. Mr. Benton, can you do me a favor? Can you sit down? Thank you. Okay, so in this part, I'm going to check the pupil of the client. So the pupil is the black color or black dot in our eyes around the iris. So the normal size of the pupil is 2 to 4 milliliter during bright light and 4 to 8 during dark light. So what I'm going to do right now is I'm going to check your pupil. It's the black color into your eyes. So in doing that, we need to make sure that the room is dim or if not, we can just actually cover the forehead of the client. So I'm going to cover the forehead of the client, assuming that I have a pen light, okay? So I'm going to cover, just look at my eyes or my nose. Then, can you, from this part, from the side, the left side, left eye of the patient, I'm going to move my pen light so the client is looking at me. So I'm going to flash some light into your eyes, okay, Mr. Benton? So I'm going to move it into the pupil of the client. So after the left eye, I'm going to check the right eye. So from the side, then to the middle of the pupil. So we need to make sure that the pupil of the client, it's equal, round, and reactive to light and accommodation. So in checking the accommodation of the pupil of the client, so Mr. Benton, can you look at the pen? Okay, so I'm going to move forward it close to your nose. Okay, so just focus on the object. Okay.
Okay.
So just look at the pen. Okay, so that's how we check the accommodation of the pupil of the client. So far, the pupil of the client is it's equal in size. Then it's also reactive to light. So how do we know that it's reactive to light? It's reactive to light when it's constricting, when we're flashing the light into the pupil, and it's also accommodating because the pupil of the client, when I move the pen towards his nose, it's moving. So question, what if the other pupil or the other black dot into the eye of the client is not the same on the other, like the right side is bigger and the smaller one, the left side is smaller? So it's an indication that the patient has anisocoria, okay? So far the patient doesn't have anisocoria. His pupil is it's dilated, it's equal in size. So next, after the checking the pupil, we need to move forward to the next test, which is the motor test. So for the motor test, the way we score it is strong, moderately strong, weak, and absent. So Mr. Benton, can you grip my hands? Okay. And can you move your feet, your legs inward? Don't let me push it, okay? Inward. Don't let me push it. And outward. Okay. So in this case, the patient motor test is strong. So the hands as well as with the legs is strong. So after the motor test is our muscle strength. So for muscle strength, how do we score it is from 0 to 5. No contraction, there is a slight contraction. Full passive range of motion, full passive range of motion, full range of motion, then full range of motion against some resistance, then full range of motion with full resistance. Okay, so Mr. Benton, can you shrug your shoulders? Okay, and can you put your hands like that, palm out? Don't let me push it, okay? Okay, don't let me, just do it like same. Don't let me pull it like that. Okay, can you do the boxing hands like that? So don't let me pull it, then don't let me push it. Okay, can you do like this? And don't let me push it, and don't let me pull it. Okay, so that's for the upper extremities. So the muscle strong of the patient is it's 5 because it's a full range of motion with full resistance. So right now let's move forward to the lower extremities. So can you lift your legs, Mr. Benton? Okay, so don't let me push it, okay? Okay, then don't let me pull it. Okay, so can you flex your feet? Don't let me push it. Okay, and this one, don't let me push it. Okay, so don't let me push it, and don't let me push it. Okay, so the muscle strength of the patient is again, it's perfectly fine. So that means that it's full range of motion with full resistance. So that's all for my return demonstration. So after that, since I was able to perform all the procedures. So it's very important that we thank the patient for his cooperation. So Mr. Benton, I was able to perfectly perform all the procedures for the neurologic vital signs. Thank you so much for your cooperation today. And if you have any questions, you can always call me or you call your doctor. Okay?
Okay.
Thank you. And after that, we discard all the equipments and we check. I mean, we document all the necessary the necessary results for the examination.